very welcome to this conference on integrating evidence and action shaping the future of alcohol research.
The first alcohol research conference, integrating evidence and action shaping the future of alcohol research. I think it's such an important topic.
And one of the key things that was mentioned was an opportunity for people to share the work that they're doing, because there is so much going on.
I suppose awash with evidence in relation to alcohol-related harm. But this was the headline, "Our booze is cheaper than water." It also incidentally showed that pub prices hadn't changed very much, and I'll come back to that.
So I'm going to be discussing the burden of alcohol-related liver disease admissions over 6 years in Ireland.
So how do you get evidence into policy? Well, traditionally, I think the way researchers think about this is, you do your research and then you think about really innovative ways to disseminate those findings and make sure the policymakers have heard about them.
It takes a long time to formulate and to enact policies, and that in the meantime the ground or the landscape can change.
Within the States, they've got this SBIRT model that many of you will be familiar with, which is called screening.
He was a healthy man other than a known background of heavy alcohol intake.
I know there's lots of gaps with information, but is there anything that we can do to better explain what's happening with regard to treatment?
That oral thiamine should perhaps be reimbursed or access to it improved for these patients.
It's been shown that population-based public health interventions to reduce alcohol per capita will reduce harm from alcohol.
Know the Score is a substance use prevention programme. The aim of the programme was to educate young people around substance use.
As Ireland is an EU member state and part of the single market, we had an obligation to refer our draft regulations in relation to health warning labels to the European Commission. And as part of that, member states could weigh in on whether it was compliant with EU single market laws.
We continue to drink quite a lot, but we have seen a 10% decline since 2018, since the legislation was introduced.
And at the younger ages of 12 and younger, and 13 to 14, females were more likely to have had their first drink at that point compared to males.
So we might just to finish off, maybe just with a closing remark.
We need to take heart in the data, recognise that we can make change.